And welcome into this edition of ACAP Today for the week of November 1st, 2021. I'm Jason Parent with the Aroostook County Action Program. On this week's edition of ACAP Today, we're going to talk with two experts in the upcoming, actually it's happening right now, open enrollment season for healthcare insurance marketplace. We're going to talk about what's new, especially here in Maine. There's some really good news for folks here in Maine as it relates to that, and how you might be able to get assistance if you're looking to navigate the healthcare insurance marketplace between now and the 15th of January, which is the open enrollment period. We're going to get to that in just a little bit, but before we do that, as we do at each point in the broadcast, we're going to first begin with the news and information that you can use from the Aroostook County Action Program this week. And we begin by sharing with you that our 2022 Directory of Services is now available digitally. A printed version will follow in the coming month here. And so if you would like a printed copy, if you'd like to request one, you can request one through the email address info@acap-me.org. We will be disseminating printed copies throughout our communities in the month of December. The actual printed copies will be available later in the month of November. But if you'd like to receive one and otherwise don't get one, please do email us or give us a call at 764-3721. In the meantime, we invite one and all to check it out on our ACAP website and see the Directory of Services, as there are a number of new programs, both pandemic related and expansion programs that the agency has added, such as Youth Homeless Demonstration Project and others that we invite you to read about in our new 2022 Directory of Services. This is especially meaningful for partner organizations who have customers to refer to us, but certainly to members of the public as well, and we invite you to check it out. The Youth Leadership Conference for the state of Maine through the Maine Youth Leadership Action Network, Maine Action Network, is happening this week, November 4th and 5th. We are inviting youth from Aroostook County to participate in this, and we are providing assistance with travel here through the agency. If you would like to reach out to Meg Hegman here at ACAP, we can provide assistance for travel-related expenses to this for youth who would like to go. To register for the conference, visit mayan.org. We certainly encourage Aroostook County youth to go. It's a conference planned by youth for youth, and this is your opportunity to be a part of an exciting two-day conference held at the University of Maine in Orono. The WIC program is very pleased to announce there is additional dollars for fruits and vegetables that is being offered through December of this year. So for the next couple of months here, for children ages 1 through 5, there's additional $24 in benefits. For pregnant and postpartum women, that benefit is $43, and for breastfeeding moms, it's $47. Additionally, we encourage you to contact our WIC program here at ACAP, Rochelle Roy in particular. You can email her or give us a call at 764-3721, and we will be glad to talk to you about how you can access the WIC benefit if you aren't already, or make sure that you're taking full advantage of this additional benefit to help you get fresh fruits and vegetables heading into the holiday season. We are also pleased to announce that through our the Aroostook Drug-Free Aroostook Coalition and ACAP's prevention programs, that we are providing marijuana edible lock boxes with plans and to distribute these boxes in the coming weeks to members and local businesses. This is to help keep children safe from accidentally having marijuana edibles fall into young hands, as some of those are very attractive for young children in particular. The boxes are of no charge to households who would like them or businesses who would otherwise like them. You can contact Robin Thurston of ACAP's Drug-Free Aroostook program at rthurston@acap-me.org, or again, give us a call and we'll be glad to connect you with the marijuana edibles lock boxes that we're offering, again, free of charge to our community members. We also want to give you a heads up that coming up on the 18th of November, it's the annual Helping Hands for Warm and Safe Homes Telethon on WAGM TV from 5:30 a.m. until 8 p.m. at night. We encourage community members to call in, make a donation. We know that letters have gone out to past donors, but if you would like to join in on donating, we are also going to be putting our HEAT team to work that day. They'll be accepting calls to schedule appointments, including doing some appointments on the spot. That's on Thursday, November 18th. We'll be taking calls both to receive help as well as to give help and to provide assistance for emergency fuel calls for individuals who don't otherwise qualify for the Home Energy Assistance Program. So please do connect with us on that day. It's again a partnership between the Aroostook County Action Program, the United Way of Aroostook, and WAGM TV, our media sponsors who provide us with most of the day's airtime that day. And we look forward to connecting with you on the again, 5th annual this year, Helping Hands for Warm and Safe Homes Telethon, November 18th from 5:30 a.m. to 8 p.m. Our Let's Go 5210 program is reminding folks, especially school nutrition personnel, that there are a couple of upcoming workshops, both on this side of the year and in the new year for school lunch professionals. These include the Healthy Breakfast Ideas to Fuel Success happening on December 1st. From 2 in the afternoon to 3:30 in the afternoon, and then a second workshop happening in early March, Seasoning School Meals, Adding Pizzazz to Their Plate. These two workshop sessions are free of charge for school lunch personnel to participate in, and we certainly encourage any school lunch personnel out there or any others interested to register. You can give Renee a call here at ACAP. Our 5210 program coordinator, Renee Bragdon, will be glad to connect you with this opportunity. Information sessions to learn about available and new resources continue. Our third and final one will happen this Wednesday, November 3rd, from 1 to 2:30 p.m. It's a 90-minute session in which we have several of our programs, especially those programs to help individuals get through the upcoming long and cold winter months. Everything from an overview of our heating assistance program and all of the available resources there, to the rental assistance program, to the quarantine social supports that we're providing the community, early care and education programs, anything that can help a family or an individual or household get through the upcoming winter months, including helping folks connect with employment with our workforce development program. We encourage you to contact us at 764-3721 or at info@acap-me.org if you would like to register. Again, this is the third in a series of 3. They're actually repeating themselves. So if you missed the first 2, this is your opportunity to get in on the last one that will be held again this Wednesday from 1 to 2:30. If you are in need of help paying for rental assistance, speaking about the programs that we are going to be discussing in that session, the Emergency Rental Assistance Program is available. It's essentially for everyone who qualifies in terms of the income guidelines, which are available on ACAP's website. We encourage folks who are renters to complete an application, and those who believe that they fall within the income guidelines at mainhousing.org/COVID-rent. The threshold other than income eligibility for participating in this program is simply that you can claim additional expenses as it relates to the pandemic, and certainly the additional cost of groceries that you're paying for, or cost to heat your home, or even to travel to and from work, or to fill your car up with gas, are expenditures that count in terms of additional expenses as a result of the pandemic. So we encourage anyone who thinks they're income eligible to apply. We can also work with households who are slightly above the income guidelines to see if there are other expenses that might be deducted. In addition to rental assistance, there is also utility assistance that goes with this program. Again, we encourage you to reach out first to fill out an application. If, however, that you are facing foreclosure, or that you feel that foreclosure actions are imminent, we encourage you to call us directly at 764-3721, and we'll connect you with our housing stability team that will help get the application taken care of sooner, and also help mitigate and work on any of the challenges you might be facing with foreclosure, or I should say eviction at this point. Hope and Prosperity Resource Center has reopened at 1 Edgemont Drive, ACAP's newest facility on the industrial park and in Presque Isle. This is the location, the former location of the Aroostook Agency on Aging. ACAP is currently occupying the entire building with administrative offices on the upper floor and the Hope and Prosperity Resources on the lower floor, with our intent of purchasing the building to establish a 14-unit supportive housing project. That will be done over the next 18 months to 24 months. But in the meantime, the Hope and Prosperity Resource Center is open from 9 to 3 daily to work with individuals experiencing homelessness, or those who are otherwise housing insecure, or just individuals who would like to connect with a variety of ACAP services on site and in person. We welcome folks to come in. If you have any questions, please contact Jeannie Fox. Her number and her email address are there on your screen. ACAP's Early Care and Education program is expanding. Our new infant and toddler room program is opening now in Fort Kent. That's an additional classroom there. We're also working on facility improvements to our Gouldville Early Care and Education Center in Presque Isle, and anticipate announcing soon the expansion of additional classrooms in that facility to accommodate the large number of individuals who are awaiting placement in an early care and education setting. All ACAP programs, early childhood education programs, are state of Maine quality 4 rated. That's the highest and one of only 2 entities in Aroostook County that offer that level of service. And we also have select placements in our Head Start and Early Head Start programs in the programs that we offer across Aroostook County. Best thing you can do is to give us a call or to fill out an application online, and we will be in contact with you about opportunities. But the Fort Kent infant and toddler room, again, is open, and we have a couple of additional slots left there. And this is for children between 6 weeks and 3 years of age, and there are no income requirements, and we will gladly assist you with working toward getting subsidy for your child care payment if you qualify for that. We'll work with you and the Department of Health and Human Services to help get that for you. So please do give us a call or apply online. We also want to remind folks that the winter season and the cold days are upon us, and or shortly upon us anyway. And we are offering winter coats as well as clothing available through our Community Closet initiative, which is available to anyone 24 hours a day, 7 days a week. It's located at our 771 Main Street ACAP office. We do overnight just put a limited number of coats out. So if you're looking for a wider selection of coats, we encourage you to visit us between 8 and 5 Monday through Friday, as we have an additional supply in the building, and we gladly help you shop for that. These are free of charge, and we also encourage individuals with gently used or new coats that they'd like to donate or clothing for this project to please do so, and you can drop those off 24 hours a day, 7 days a week at the facility or during our business hours, and we'll gladly help you get those in the building. And we also want to remind folks, again, pertinent to the cold weather, that the Home Energy Assistance Program is continuing to take applicants for this season. For those of you who were enrolled last season, you should have received by now a supplemental benefit that went directly to your fuel vendor. If you have not, please give us a call, as that should have been processed by now. We also want to encourage folks to look at the income eligibility guidelines, which I have on the screen and are also available on our website. What's new this year is we are allowing just as little as a 1-month look back on income level. So if you've had a change in your household income as recently as the last month, and it falls under the numbers listed here based upon your household size, we very much encourage you to call us for an appointment, and also reach out to us. Again, Telethon Day is coming up on November 18th, and we'll have some available appointments that day for folks as well, if you'd like to reach out on that day and don't already have an appointment. If you do have an appointment this season, even with the supplemental payment, is very important that you keep that, as that will be your appointment and your allocation for this 2021-2022 heating season. And we also remind folks out there who are in need of a COVID-19 vaccination, including those who are now eligible for a booster shot, that the available website, maine.gov/COVID-19/vaccines, is a resource where you can see where your local vaccination site is available. We can also help. We know that Northern Light Air Gould, for example, is now booking appointments in the afternoon here in Presque Isle and at other locations. And if you are unable to go online to book those appointments yourself, we can help. If you're age 55 or older, the Agency on Aging, the Aroostook Agency on Aging, can certainly help you as well. But we also want to remind folks of the free vaccine ride program. So if you are in need of getting to and from an appointment, the state of Maine, through the Department of Health and Human Services, is offering a free ride program with a 48-hour advance notice. The number is there on your screen, and we encourage folks to take advantage of that. Don't let not having transportation be an impediment to getting your vaccination. We also want to remind the community that we are providing COVID-19 quarantine social supports through the agency. So if you are in need of free temporary help with things like grocery and meal delivery or lodging, if you're asked to quarantine and isolate away from your family, or any host of other services that are provided that are listed there on your screen, we encourage you to reach out. You can go to the Department of Health and Human Services website listed there, or you can give us a call and we can help you access that location. We offer this service countywide, and it is offered as needed, even if the weekend or evening hours are when you need a delivery made. We have a team of coaches and navigators standing by to do this work. So especially if you're asked, or this is most especially if you're asked to isolate or quarantine, please do reach out, as we don't want you, we want you to be able to stay in your home safely and keeping others safe. Allow us to give you a hand with this. This is also available if you are a loved one a loved one downstate who has been asked to isolate or quarantine, and they ask you to help. You can help on this in terms of filling out the application on the website, the DHHS website. There are 9 other community action agencies in Maine, and all of them are providing this service as well. So the local community action agency would be dispatched to help with your QSS support service report for a loved one, again, with their permission, in another part of the state of Maine. And lastly, if you or your family need assistance in any way other than what we've already talked about, and even including what we talked about, we do have a team of ACAP navigators who are available to help. We know that it's a difficult time for many individuals right now, and many of you do not know how to, or have never had to navigate social service systems before. And we understand that that can be frustrating and challenging, and that you might not know what's available, but the ACAP Navigator team is here to help, and we encourage you to reach out at 764-3721 and ask to speak to a navigator, and we'd be glad to help navigate those services, both within our agency and with partner agencies outside of ACAP, including government resources that we can help you access through our navigators. And that's this week's news and information that you can use. I'm now pleased to welcome officially to our program 2 guests, both repeat guests on this program. The first is Patty Lovell, who is a friend of ours from Western Maine Community Action Agency, who oversees the consortium of navigators for the healthcare insurance marketplace throughout the state of Maine, including our team here at ACAP, which is led very capably by Andrea White, who is a repeat guest, and we'll be talking about our healthcare navigation program on this week's edition. She kind of pops up talking about various topics, and this week we're going to talk with her about her role in healthcare navigation. So Patty and Andrea, welcome back to ACAP today.
Thank you for having me.
All right, so let's get right into it. Patty, you lead navigators throughout the state of Maine, and you came on our broadcast about a year ago now to talk about this very same topic. But boy, a lot has changed in a year, and there's a lot of new things that we need to share with folks. So let's start right in terms of what's new this year with the healthcare insurance marketplace navigation.
So the exciting new thing this year is that instead of being through healthcare.gov, which is a federal platform, we and 3 other states in the nation now provide our own state-based platform at CoverME.gov. The state of Maine has been working on this for the past 18 months. It's rather exciting. It's rolling out yesterday. And so it's exciting because we'll be able to accommodate the special needs of the Maine citizens. For an example, in 2020, when the pandemic began, states who had a state-based platform could go in and make a special enrollment period for COVID because of the pandemic. The federal platform did not open up until February 15th of 2021. So with the change of administration came the change to the special enrollment period for COVID. But being a state-based, we could have opened up for a special enrollment period, which is exciting in that we, again, will be able to meet the needs of Mainers easier. The other exciting part is that because of this, the special enrollment period has expanded to include women who are pregnant. So prior to this, if you did not have health insurance and you were pregnant and you did not qualify for Maine Care coverage, you did not have healthcare coverage for your pregnancy. But because of the special enrollment period now provided through the state-based exchange, we are going to be able to have a special enrollment period should you not have coverage prior to, but become pregnant outside of open enrollment. So that's exciting.
That is very exciting. Now, Patty, in terms of individuals who had registered through the federal site last year and are looking to sort of navigate and maybe shop around, because I think we were encouraging folks to do that. I know we were last year at this time because there's things changed and certainly things have changed this year. How are folks interfaced with the federal website last year going to be able to interface with this one? And is there sort of a carryover so folks aren't, oh my gosh, everything's changed and there's no record of what I had, and I'm a little anxious about that? Sort of walk people through that process.
So there will be a carryover. Most people should have received a letter already from healthcare.gov letting them know of the change. Maine becoming a state-based platform. And what will happen is they will, as I understand it, they'll be able to go in, put their information in once they have verified. Their information from the federal platform should transfer over to the state platform. And so they won't have to re-enter all the information, but they will have to create an account on the CoverME.gov and then verify their federal platform information, and it will load. And the great thing is, prior to open enrollment, people were able to go in since October 15th to look at plans and premiums. And the 3 carriers that were on the federal platform will continue to be available on the state platform. That's Harvard Pilgrim, Anthem, Blue Cross Blue Shield, and Community Health Options.
Now, I know, Patty, that oftentimes people ask, or people make the assumption, I should say, that health insurance is expensive. But in the work that you and Andrea and others across the state of Maine do, you found, I believe, time and time again, that oftentimes there's a misnomer around that, and that people who walk through the process with you or who navigate it themselves end up finding out that it's not as out of reach as folks might have thought. Is that, number one, still the case? And in this case with CoverME.gov, are there even better incentives this time around?
So the great thing that happened, part of the American Rescue Plan, was that it increased the subsidies available for health insurance. And so that began on January 1st of 2021, and that's going to carry through for 2022. So those increased premium subsidies will be available for the upcoming coverage year, and that's exciting. I know that I worked with several people who updated their information after July 1st and were able to see savings as high as $90 per month. So their premium had been $140 and it went down to $50. It was just amazing. I worked with another family. There used to be what was called the cliff, the benefit cliff. So if you earned over 400% of the federal poverty level, then you received no subsidies. That has since changed with the American Rescue Plan, and those subsidies continued over. So only 8.5% of your income would be used for health insurance. And so one family that I worked with prior to that had an income over 400% prior to was going to have to pay 100% of the premium. When they went back in after the American Rescue Plan updated their plan, they had a $331 subsidy to help pay for the premium. So it was a substantial savings, and we're seeing that over and over again with families and individuals receiving savings up to $50 and over per month in premiums.
Oh, that's impressive. And Andrea White, I know that you had come over to ACAP from healthcare and certainly have watched individuals and families sort of struggle with understanding and comprehending the complex world of not only healthcare, but of health insurance. And sometimes, even thinking that it might require a PhD, and by that I don't mean the colloquial potato house degree that we talk about here in Aroostook County, but more so just sort of additional advanced knowledge. And talking health insurance is not something that, and understanding it is not something that folks altogether do too easily. So talk about your role and the importance of being able to help individuals to understand all of what Patty was just talking about and what might be best for them through the CoverME.gov.
So that's a really good point, Jason, is that there's nothing easy about health insurance. Whether you're a doctor or whether you're a patient, it's very complicated. I don't pretend to know everything about it, but I just know that, if you have it broken down and explaining what is your premium, what does a premium mean? What does a deductible mean? What does co-insurance mean? What do all those things mean? And how do I have to pay for these things? What is ultimately going to come out of my pocket, which is really the most important thing to be able to understand. So what's interesting about when you go onto the CoverME.gov platform, and you can do some window shopping right now. So the open enrollment period doesn't start until November 1st, but you can get in there right now and you can compare plans right now. And they ask you to put in your zip code, because it's actually very zip code specific, because what would work for somebody down in Portland is not going to be available to somebody up here in Aroostook County. So it's very specific to your part of the state, which is really important. Then they're going to ask you to put in, what medications do you take? Where's your provider? Who's your provider? There's a lot of, for example, my primary care provider is a part of the Northern Light Health Plan. It's going to tell me who does not accept Northern Light Health, this insurance at Northern Light Health, or, so those are things that are really important to me. So I'm not going to pick this plan if Northern Light Health providers aren't covered in this plan. So right now it's a great opportunity to go in and put in your particular demographics and the demographics of your family. They're going to do some magic algorithm, space agey stuff, and they're going to give you, boom, these particular plans are what's right for you. And what's interesting is that there's a lot of things that are really important to us, like emergency services, for example. I think you have a slide for that, Jason. I don't know if you want to put that up on the screen, but, emergency services, is my emergent, visit going to be covered? Hospital stays. Well, that's really important. We really want to be able to have a hospital stay covered. Lab services, again, really important. Ambulance rides, boy, I hope you never have to have one, but we want coverage if you do have to have that. And what Patty was saying earlier about pregnant women and newborn care, that is a brand new thing that we have now at CoverME.gov that wasn't there before. It wasn't available, and now it is. So you are able to enroll not just in the very small enrollment period of November 1st to January 15th, but the day you find out you've become pregnant, you can actually enroll. We also have pediatric services, including dental and vision. Prescription drugs, that is super important. We want to make sure that your drug that you have to keep you alive or to keep you functioning as a normal human being are available. Rehab services, mental health, that's another really key player in the world today. We want to make sure that everybody has their mental health taken care of. Preventative service and chronic disease management. So is that plan going to cover that 50-year-old colonoscopy that you now have to have, or your prostate exam that you now have to have? All of those things, so they ask you for, what do you think in the coming year you're going to need to have? Well, let's work with that. Let's see what coverages are available for not just what you're going through now, but what you might need 9 months from now, what you might need a year from now until December 31st, of this year. So they ask you to sort of predict. They ask you to, like, in your mind's eye, say, okay, I predict that I'm going to have that colonoscopy, or I'm going to have that chest x-ray, or all of these things. Are those things covered? And it will give you some choices that you can navigate through. And so it's a really fun little, it's almost like playing a game, click here, click here, click here, and we'll figure out exactly what you need. And if you have trouble, you can certainly reach out to me here at ACAP at 554-4150, or just shoot me an email. I think Jason had that up on the slide earlier. So you can reach out to one of us and we can help walk you through it, whether in person or over the phone. We can certainly help you out.
So Andrea, now that we are beyond November 1st and in the open enrollment period as folks are viewing this, what does a typical opportunity to connect with you and to help be navigated both through the site and through what healthcare options or health insurance options might be best for you to, what does that look like? Talk people through what they can anticipate when they connect with you and what might happen.
I think the first thing that when you call me, and if I'm not able to answer the phone right there, please leave a message. I always return phone calls. And it might look like, okay, let's walk through this together. Show me what you're looking at on your screen or on your phone, and I can sort of help navigate you through. If that's difficult for you, it could mean that you come in here to the ACAP at 771 Main Street, and maybe we can talk in person. We'll each have our masks on. We'll be, social distanced enough that we're safe, but close enough in proximity that we can work on this together and try to figure out what is best for you. And as an assister, I can't pick a plan for you. It's something that we can look through together and say, oh, this has this offering and this has this offering. What do you think you would benefit best from? That is not up to me to be able to do. I'm actually not allowed to do that. So it's a matter of working together to say, hey, this is what this looks like, and this looks like this, and this looks like this. What do you think works best for you? And then we can go ahead and get you set up.
Great. Now, Patty, for the perspective of helping folks understand, you talked earlier about, the changes in some of the savings that people might be able to get on their monthly out-of-pocket expense in terms of the deductible. But I think it's always helpful to have you revisit and review to us how actually health insurance works in terms of what costs you might incur. And so you've provided us with this great example, and I'm going to bring it up on the screen now, and sort of if you could walk people through what they can expect both from health insurance in the open enrollment in the marketplace that you are navigating folks through. But this is really, I think, true across the board in terms of health insurance plans that most employers provide and others.
Yeah, so there's so many terms in health insurance, and one of them is, so I'm paying a premium and now I have a deductible, and then I have co-insurance, and then there's this out-of-pocket limit. There's so many terms. So at the beginning, what we're looking at is, so in order to have the insurance pay outside of those 10 essential things, so there is a deductible, and there are certain things that your preventative health is covered 100%. But if you're going to your doctor's for a different reason, for non-preventative, then you may have to pay out of pocket for that visit. And so the example that they provided is that the plan's deductible is $1,500. So you would pay the first $1,500 of non-preventative care, whether that be for prescriptions, a regular doctor visits, that's not a preventative visit, those kinds of things. So you're going to pay that amount of money, the deductible at the $1,500. And then after that, you have a co-insurance of 20%. So now your insurance is going to pay 20%, and you're going to pay, they're going to pay 80%, and you're going to pay 20%. Sorry about that. So there's now a second part, and I refer to this as a two-story house. The first story is the deductible. And so you are paying all of that amount, which is $1,500 in this example. The second story is now the $5,000 out-of-pocket limit. So between the $1,500, which is the first story, and the $5,000, which is the roof, you've got the $3,500. And so your insurance is going to pay The 80%, you're going to pay 20%. Should you get to that ceiling, which is $5,000, they will then pay 100% of any additional bills because you've met that maximum out of pocket of $5,000. So it's, like I said, the best example I've come up with is a 2-story house. The first story is your deductible. The second story is your maximum out of pocket. And then after that, your insurance will pay.
And that clock resets itself every year, correct? It's a January.
It does, January 1st. So there have been times where people have met their deductible because of expensive medications by January 31st. There are other people that only go to the doctors for preventative health reasons. They're very lucky, they're very healthy, and they may never get to that meeting their deductible because they haven't used anything but preventative health. They don't have any prescriptions. And so again, they're very fortunate. So it just depends on what your medical expenses are.
So Andrea White, who should and who shouldn't look into the options through the open marketplace here in the state of Maine, and also consider connecting with you as a navigator?
Well, I think everybody should have a look, Jason. I just spoke with a woman this morning who had said that her husband's health insurance premiums through his place of work were astronomical and they just couldn't afford it anymore. So I invited them to have a look at what CoverME.gov has to offer. It very well could be that there's planned premiums, if it's just the two of them, that might work better for them. The only thing is when you do have an employer-based healthcare program that's offered to you, you may not be entitled to the subsidies that if you didn't have that option, like you had no insurance offered to you whatsoever through a place of work or anything like that, you may not get, you would get the subsidies that would be offered to you. But if you do have a readily available health plan available through your work, you're not going to qualify for a lot of those subsidies. So maybe Patty can actually explain that a little bit better. But even if not, even if you don't qualify for some of those subsidies, it may still be, you still may be better off. But I think Patty might be a better person to really dive into that a little bit more.
Sure, Patty, why don't you take that if you could?
Thanks. It does get very confusing because there is a rule that if more than 9.61% of your income is paid toward your premiums through your employer-based health insurance, you would qualify for subsidy. However, so just for round numbers, if you pay 9% of your income is paid to your health-based insurance through your employer, you would not qualify for any subsidies through CoverME.gov. However, if it costs 10% of your income for health insurance premiums through your employer, you would qualify for subsidies. And there is a calculation process. You would need to provide additional documentation to verify everything that you've provided. But you could access the subsidies to help with affordable health care. There is such a thing as called family glitch, and it is something that the federal and the state government has looked at eliminating, but has not done so. And it has been there since the beginning of Open Enrollment 1 back in 2013. And that is if you, and the example that Andrea gave, husband and wife, husband has health insurance available through his employer. He can also get dependent coverage for his spouse. The spouse would not qualify for subsidies on the CoverME.gov platform because you can have health insurance through your husband's employer. Even if it costs for both you and your husband more than 9.61%, it does not count the dependent cost of the premium. It only counts the employee's premium at that 9.61%. So it's what we call the family glitch. It's very frustrating is the only word I can come up with when families are faced with the employee having dependent coverage available through his work, but it's going to cost up to $1,500 a month to cover the spouse and 2 children. But they're not, they cannot get coverage with subsidies through healthcare.gov or, CoverME.gov. It's very frustrating, and it's something that, again, the legislation has looked at but has not addressed at this time.
Just so I'm clear on that, Patty, and so our viewers are, so somebody who is employed and has a health insurance plan through their work, including the opportunity for other family members to be covered, they will not qualify for the subsidy, but they can still potentially shift over to the marketplace if they shop around and find that that's actually less expensive and come off of their employer's health insurance plan?
They can purchase a full price plan on CoverME.gov. They would not qualify for any subsidies, but yes, they could purchase a full price plan.
And generally, would it be an anomaly for that to be more affordable for someone than to go through their employer? I mean, is it common that would be the case? I
have yet to have a family purchase health insurance through the federal or state platform, because it's usually, it may be cheaper, but it may be better coverage through the employer. The deductible may be lower. Every situation is different. It's something that people could explore, but it's usually not financially feasible.
And so essentially, we really want to encourage folks who are uninsured through no other mechanism. Those are folks especially who should reach out to folks like you and Andrea to better understand options through the marketplace.
Absolutely. And if the employer doesn't provide dependent coverage, then they would qualify for subsidies. So same scenario, but there's no dependent coverage through the employer. The spouse and 2 children could get subsidies through the CoverME.gov platform.
Well, that's great to know, because those situations do occur out there. And so so for those folks out there who, again, do not have a dependent care coverage as part of a spouse's employment work plan, you definitely want to reach out to our team here to understand the nuances and the opportunities that exist. One other question as it relates to this and the sort of the ease of transition. Many people are often sort of potentially on that bubble of whether they might qualify for main care or not. And through this system, do I understand correctly, Patty, that there's a little bit more of an ease of determining that through CoverME.gov?
There is. So people who are at 138% federal poverty level or below will qualify most times for main care. And if putting your information into CoverME.gov, it determines that you would qualify for main care, it will then transfer your application over to DHHS. You would need to do nothing in addition to that application. It would transfer it over to DHHS during open enrollment or a qualifying life event for a special enrollment. However, outside of that, you'll still want to do the traditional methods of either calling or filling out an application by paper or on My Main Connection. But yes, if you do qualify for main care, it will send it over to DHHS.
So again, that just underscores that there's lots of nuances to this and a lot to understand. And that's exactly why the Navigator program is available for you to help navigate, even though the website is tremendously helpful. Sometimes just sitting down, whether it be virtually or in person, and having a conversation and discussion about how to best navigate and what might be best for you. Again, want to remind folks that our navigators are not there to sort of direct you to any specific plan. As a matter of fact, they're just there to listen and to help you, especially with the technology and with understanding some of that lingo and the language, such as deductibles and out of pocket and things of that nature, which can get very confusing. We put back up on the screen now the slide of how you can connect with Andrea White if you're in Aroostook County to connect now that we're in the open enrollment period through January 15th. To connect with her either at the email address or the phone number on your screen there to make that connection happen and to better understand what you're looking at CoverME.gov. Before we leave, the two of you, anything that we haven't covered that either one of you want to make sure folks know about this open enrollment period and these new opportunities to connect with health insurance?
So one thing I would like to add is that this year, for the first time, open enrollment will go through January 15th. However, if you want coverage to start January 1st, you need to make sure to apply between November 1st and December 15th. But if you apply between December 16th and January 15th, it would start February 1st. So this year, for the first time, we are expanding open enrollment by 30 days. So I encourage people to still, schedule an appointment and meet with a navigator or a main enrollment assister, is what we're officially called now by the state, to start that healthcare coverage on January 1st. But should you on January 3rd have a New Year's resolution that you want to be very healthy, and part of that is having health insurance, definitely get a hold of a main enrollment assister quickly, and before January 15th enroll.
Well, there you have it from the guru of Maine enrollment assisters and Aroostook County's own enrollment assister, who works alongside a couple of other folks here at our agency to help get you connected with the healthcare insurance marketplace through the new CoverME.gov website and options that are available there. Andrea White, any last parting words from you?
I think that Patty did a beautiful job covering everything. And I think that there's a lot more information on the CoverME.gov website. I certainly invite everyone to get on there and look around, play with it, and just see what information you can get. I find that that is the best way, just to get your feet wet and get your hands dirty and get right in there and have a look around and don't be afraid of it. Don't be afraid of it. Just figure out what you're going to figure out and then give us a call when you're ready or you need some extra assistance. We'll be here for you.
All right, and we're here to help you figure that out. So please reach out to Andrea if you are in need of assistance. And now through January 15th, she's also available after January 15th as well, especially for those who can get into the insurance marketplace under special circumstances, which, as we covered, includes pregnancy, birth of a child as well, in this new opportunity through CoverMe.gov. So with that, I want to thank Patty Lovell and Andrea White, our guests on this week's edition of ACAP Today, who taught us all things about the new CoverMe.gov and healthcare insurance marketplace here in the state of Maine. Before we leave all of you this week, we want to remind you that if you are interested in joining our ACAP team, we do have a number of openings available across Aroostook County, including a couple available in Washington County, where we're expanding our youth homeless demonstration program. So we have social worker positions available in Machias and Calais. So if you know of any folks down there who are looking for employment and have those credentials, we would gladly speak with them. But as you can see, we have positions available across Aroostook County and certainly encourage you to join our team. We are currently offering a $500 sign-on bonus. And as appropriate as this program is, we have several opportunities for a great benefits package, including medical, dental, and vision, and look forward to hopefully seeing your application. You can check out our Facebook page and our website for more information on current openings and how to apply online. And lastly, as we do at each point in the broadcast, we share with you our snapshots of the week, which come to us this week from two of our early care and education centers. The first photo there with the tables in it is from our new Birch Street location at the Presque Isle Housing Authority, where our children there at the community center are taking early care and education classes, both a Head Start class offering as well as a childcare classroom there. And they're enjoying new swings, as are our students at our Holton Early Care and Education Center. Actually, there's no students in that picture, but a picture of the swings that have been installed, of the new swing sets installed at both Birch Street and Holton, as well as not pictured here, our Gouldville Early Care and Education Center got new swing sets last week as well. And so there are plenty of swings equaling smiles, our snapshot of the week this week, as we leave you on this edition of ACAP Today. We'll be back next week with a brand new edition. I think we're going to be featuring and talking a little bit more about our Helping Hands for Warm and Safe Homes Telethon with the partners on that project. And we look forward to that conversation and look forward to seeing all of you again next week. Have a great week, everyone.